Okay, here is the liver. The liver is in situ. Okay, the liver is the largest viscous in the abdominal cavity, and it's the largest gland in the body. It weighs about 1.5 kilogram. It's responsible for a range of functions that include synthesis of proteins, synthesis of clotting factors, detoxification of certain agents, and a lot metabolism and a lot of functions. Okay, the liver lies in the cadaver, in the abdominal cavity, in the right, mainly hypochondrium region, the epigastrium with some extension into the left hypochondrium region here. Okay, so it's connected to the anterior abdominal wall that I will later discuss by the falciform ligament being attached to the diaphragm, okay, and the anterior abdominal wall here in the midline. Okay, the inferior border of which carries the round ligament of the liver. It's divided into two parts that I will discuss later. The dividing planes between them is the right lobe of the liver, the larger one, and this is the left lobe of the liver. Okay. Now, after we have appreciated its position within the cadaver, now we move to the isolated organ outside, and in order to really consider, in order to really know its position and its gross anatomy, we have to appreciate two things. One of them is the surfaces of the organ, and the other one is the ligaments attached to it. Okay, starting with the surfaces, the liver has got two surfaces. We all know that this is not the anatomical position. The anatomical position lies like this. This is the posterior and this is the anterior aspect. There are two surfaces. This boldly convex surface is known as the diaphragmatic surface. It underlies the diaphragm, fits to the undersurface of the diaphragm snugly, and another surface which faces the other viscera, okay, mainly the stomach, the liver, and the hepatic flexure of the colon. Okay, this surface, as you can see, is irregular. It shows some flattened areas and some concavities. Okay, let's return to the diaphragmatic surface. This surface is divided for descriptive purposes into four: a right surface, anterior, superior, and here is a posterior surface. Okay, these surfaces are only descriptive. There is no anatomical landmark that really divides between them. Okay, let's move into the diaphragm, into the visceral surface. Okay, the visceral surface, as you can see here in this view, it shows the pattern of shaped structures. These shaped structure are as follows. The crossbar is formed by this part of the liver, which is the hilum or the portahepatis. Okay, the left vertical limb of the H shape is met superiorly by this structure here, which is known as the ligamentum venosum, superiorly, while inferiorly is made by this structure, which is known as the ligamentum teres, okay, or the round ligament of the liver. While the right limb of the vertical edge is formed superiorly here by the inferior vena cava, and inferiorly here by the gallbladder, relying on its bed within the inferior surface. Okay, the inferior vena cava, as it passes through the visceral surface, the posterior and the visceral surface, it grooves the surface, or sometimes it may form a tunnel that is surrounded by hepatic tissue entirely. Okay, regarding the portahepatis, which is, I have previously mentioned that it is the part of the liver that is known as the hilum, the part through which vessels and ducts pass through. Okay, the most posterior structure in the portahepatis, which lies closer to the posterior surface, is the portal vein. Lying anterior to the portal vein, to the right side, is the hepatic duct, the common bile duct, and lying to the left side is the hepatic artery. Okay, the bile duct is formed. The common bile duct is formed by union of the cystic duct emerging from the gallbladder and the hepatic duct emerging from the substance of the liver to form the common bile duct. Okay, the hepatic duct itself is formed by two ducts, right and left branches. Okay, Why the left artery here at the portahepatis, the hepatic artery, divides into two, a left branch and a right branch that supply the left and the right functional lobes of the liver respectively. Okay, that's all for the portahepatis. Let's move to the impressions made on the visceral surface by other viscera that are associated with this surface. Here on the right side of the liver, there is an impression, this concavity, which is made by the right kidney, and superiorly here, surmounting the top or the upper pole of the right kidney, is the right adrenal gland. Okay. On the left side here, this concavity is made by the stomach, and it leads upwards into this groove, which lies on the posterior border or the posterior surface of the liver, which is made by the esophagus. So this is the impression of the esophagus leading to the impression of the stomach. Here, just to the left side of the gallbladder is an impression which is made by the pylorus of the stomach, and to the right side of the gallbladder is the impression which is made by the ferrous part of the duodenum. Okay. Finally, at the lower pole of the right side is the impression which is made by the right colic flexure. Okay, that's all for the visceral surface. Now I'll return back into the diaphragmatic surface in order to describe the attachment of the mesentery. We all know that the liver develops within the ventral mesogastrium during embryological development. And this ventral mesogastrium, okay, when the liver develops within the ventral mesogastrium, it divides it into a part. We know that the ventral mesogastrium is the dense connective tissue that connects the stomach to the anterior abdominal wall. So when the liver develops within this ventral mesogastrium, it divides it into two parts. A part that lies between the liver and the anterior abdominal wall, and a part that lies between the liver and the stomach posteriorly. Okay? The part that lies between the liver and the anterior abdominal wall becomes the falciform ligament. So the falciform ligament is now evident on the inferior and the anterior surfaces of the liver. Okay? If we trace this falciform ligament upwards towards the summit of the liver, we see this is to diverge into two leaves, a left leaf, and these are the traces of the right leaf. Okay, these leaves travel in the summit of the liver. Each one travels to its own side. The left passes to the left side, while the right passes to the right side. And as they pass here, they form parts of a ligament, the superior margin of what is called the coronary ligament. And then it recurves back, becomes folded back on itself on either sides to form this structure, which is known as the triangular ligament. This is the left triangular ligament, and this is here the traces of the right triangular ligament. Then each leaf passes downwards on the posterior and somewhat on the visceral surface. These are the traces. It passes downwards on the visceral surface, okay, to form the inferior margin of the coronary ligament. So this is the superior margin, and this is the inferior margin of the coronary ligament. Okay, this is the superior margin of the right of the left coronary, and this is the inferior margin of the left coronary ligament. Okay, so the leaves that have to diverge from the falciform ligament pass each to its own side in order to form the coronary ligament, and more laterally they form the triangular ligaments. Okay, if you followed the inferior leaf of the right coronary ligament, it passes downwards to the left side in front of the inferior vena cava. Okay, then it ascends upwards in a vertical manner to approach the falciform ligament here on the top. After which it curves to the left side, forming a groove here. This groove contains a ligament that is known as the ligamentum venosum. The groove and the contained ligament then descend downward, making a 90-degree angle downward to here, and this is to form the ligamentum venosum. Okay, the groove for the ligamentum venosum here gives attachment to peritoneum, which is now become the lesser omentum. The lesser omentum then passes downward and surround the porta hepatis. Okay, between the inferior vena cava and this groove for the ligamentum venosum is an accessory lobe of liver. This is known as the caudate lobe, with some extension to the right side above the portahepatis, which is known as the caudate process. The part of the liver that lies to the left side of the gallbladder is known as the quadrate lobe. This is the quadrate lobe in front of the portahepatis. Okay. Lastly, I will talk about the division of the liver. The liver is composed of two anatomical lobes. These are demarcated by the attachment of the falciform ligament on the diaphragmatic surface, and on the visceral surface by the ligamentum venosum here and the round ligament of the liver, or the ligamentum teres, into left lobe, which is much smaller, and right lobe, which is larger. Okay, adding to this the caudate and the quadrate lobes. Okay, that's all.